slides and all. I am not prepared well also.
No problem. I will help.
Okay, the procedure is urinary catheterization. As we all know, what are the purposes of urinary catheterization? That is to relieve the discomfort due to bladder restriction. That is one of the main purpose of the catheterization. Then also, if you want to know clearly the amount of the residual urine, and also if you want to get a sterile urine directly from the bladder. So these are some of the common ways. Another important one is to empty the bladder before the surgery, and also to provide a continuous or intermittent bladder drainage. So those are some of the purposes, and especially after post-operative period, in especially the lower GI tract and other procedures, you can see post-operatively the patients will be on urinary catheter. So these are some of the few purposes of urinary catheterization. What else? And also to manage incontinence, right? So now let's start with the order. There is an order for Mrs. Rukaya. This is a patient of 65 years old, grandmother. She had undergone. She's having continuous dribbling of urine, and we are going to insert. There is an order to insert the urinary catheter. That is one of the intention of today's procedure. So what else? Before going to start the procedure, let's see the assessments. So what all things we will go and assess the patient. That is just like any other procedure. We will go to the patient, introduce myself, and all those initial steps we follow. Then I will ask with the patient. I will see that the patient is, first of all, the patient is cooperating with you. That is one of the important things, because otherwise it's going to be a little difficult. And I need to introduce about this particular procedure as such, what we are going to do about the urinary catheterization, and need to obtain a consent from the patient if the patient is conscious and understanding our terms. Otherwise, we need to explain the procedure to the relative who are there. So after getting the consent, I need to assess whether the patient is able to lie down in a supine position, because some patients are having a breathing difficulty. And for this procedure, we are going to keep the patient completely on a flat position. At least low follows is also all right. So with that is one of the assessment we need to see. Then we also will assess and see for the bladder distension or the discomfort. That also we will assess. What else? I think those are the few things. And any allergy to the type of catheter what we are using. The catheter what we are using is silicone type. This is the catheter.
There are two types of catheters. Okay, this is actually the polyvinyl catheter. This is only for long-term use. For up to 1 month, we don't need to use this. This is a very costly one, and we want to leave it for the patient at least for 3 months or more. We put this when they go home. But the other one is the rubber one, no? That is the common one which we use. And we have, this is 2 lumen catheter. We have 3 lumen catheter also. Okay, that is for bladder drainage. You will find it in the hospital setting, bladder irrigation for red male patients when they are undergoing BPH, TURP surgeries, prostate surgeries. They will be put on that catheter, because one is for drainage. One lumen, they will be giving very large amounts of IV fluids through that. So it washes the bladder and brings out the blood and urine and the tissues, all that. Okay, so you will find different catheters when you go to hospital. This is the common one which we use. This is for long-term use.
So another important thing what we are assessing is about the intake output of the patient. So already the patient, the output we need to measure, as well as here our situation is patient is having a urine continuous incontinence is there. So that is the intention of today's procedure. So let's see the articles. So we have the catheter, then we have a sterile catheterization pack. This
Same
is
size also is there. I forgot to tell about the size. Again, it is in French, like NG tube, no? We have it in the French. CH also they say. Expansion, I forgot. I'll tell you.
So here the catheterization pack is a sterile one, just like the dressing set. So the contents are written here. Very well it is written here, which includes the swabs, then yellow waste pack, then balls, that is the cotton balls, then kidney basin is there, then some forceps are there and some tissues. So these are the contents. Then also we are going to have some ghost pieces, sterile ones. Then collection, urine receptacle, the urine collection bag is there. And also we need some sterilization solutions like this. These are the sterilization solutions which are used for the skin perineal care especially, which we have used for the other perineal care, the same solution. Yes. Then why we need this syringe and a needle is required to inflate the bulb of the catheter. So we need to inflate sterile solution into the catheter just to check whether the catheter is keep in patent or not, because we need to keep it inside. We need to inflate the balloon inside the catheter to hold. So for that purpose we need the syringe and the needle and also the sterile solution. Obviously we need the lubricant. Here only available lubricant is the this one. This is the lubricant that we are going to use, and we have the swab to take out the lubricant. Otherwise we will get a sterile lubricant.
We are not supposed to use this at all. Please tell the students also. We used to get that small packet of jelly which used to be here inside. Nowadays they are not bringing. Sterile jelly only we should use, or at least the tube somebody can give it to them when they are doing. That also today it is not there. They give us always that jelly. So we should never use this. Please.
This is only because of Urinary for the medical.
But still,
Even vaginal, because it's sterile, no, we cannot use this. For other procedures, okay, rectal, other NG tube and all, it's not sterile procedure. I will try to get it before we show it to the students. The students should not have the wrong idea.
many years back we have to.
We have last time also we have. Xylitol.
That KOA jelly, no?
Then we have the sterile gloves. So to start with, I need to wash my hands. I need to
Like a surgical.
like a surgical dressing. I wash my surgical.
Surgical technique.
Yeah, keep on like this. It's a little bit understood.
Okay, cleaning and all, she's not doing.
Just like the other procedure, we have cleaned the catheter and we have cleaned the tray, as well as we need to open the tray. That is the next measure.
As much as possible, 2 nurses are who will be doing. So if she is the primary nurse, she'll go wash and come. By then the other person can open everything, put whatever is needed for them. All that we can do. It's allowed. This is how it is done in the hospital.
Now my hands, I have done only the medical hand washing, and I'm going to open the sterile pack. After opening the sterile pack, finally I will do the surgical hand wash. Push it down because it is cleaned and kept. I'll just push it down. This little bit more. Now I need to open it, right? Because we need to prepare the items.
Do you need to wear gloves sterile before? Or
No,
Just
after.
after the medical hand wash.
Keeping same like dressing.
Just like-
Keep everything ready, then only you will go for.
I'll use the tips for opening.
folds?
Yeah. Same like dressing.
So we have the items here. And also we can take the yellow one, and you can pick it up. Yeah, just pick it up. Just stick it with this.
Because it is urine, they themselves have given the plastic
Okay, inside the
kidney tray.
Okay.
So when you are
Mhm.
inserting, when the urine comes,
You have to
this is for
catch
that.
that. For urine specimen, right?
Specimen or to measure also. Sometimes the patient would not have passed for maybe 12 hours. So you will find the moment you put the catheter,
Ah, the
1000
urine
ml
goes.
will come. So we need to hold all that, measure all that, discard it, then connect it to the bag. It's fine, but enough time. You need any more. You need any more.
This also.
You need to open anything in the bag. Otherwise, when you put, sometimes it will fall down.
I've washed my hands after surgical hand washing. I'm going to wear the gloves.
We'll do it as 2 people, so that it's faster. She can start with the,
Glove.
and give her other things from outside.
Rinse here. It's a rinse it, just rinse it. No. Give it there.
Okay, if other things, we can help. If we are helping us, we will be helping.
No, maybe it's there. So I'm going to wear my gloves just like the other procedure, skin to skin. So, glove to glove.
See you later.
Tight it.
Yes, you can take. Because when we are trying to put, we may make it unsterile. So if she is wearing gloves now, it's easy for me to give it to her.
Now it's the preparation of the catheter as such. Okay. Here, if you can see the catheter, it's very interesting to see the catheter, inner cover of the catheter, because you can see this. This could be opened at our necessity. In the sense, we can open it from the down part, and also we can open it from the upper part. I'm not going to open it completely right now. What is the first preparation is we will inflate and see. So I will open it from this side. After that, I will open it from here to lubricate. So and I will keep it here. Then after preparing everything, when it is time, I will just insert so that everything looks so sterile. We keep it here first. Let me keep it in the solution. Do it to the side. Keep it to the sides.
That edge is considered to be 2.5 centimeter unsterile. So like the articles not come to that edge also. In other countries, if you see the pack, it has pre-filled syringe with the amount of water they need and jelly which is what needed, all that is there.
Everything in this
We are only not having all these things.
Move your hand, please.
write the amount, how much of water to be pushed for the bulb to be, inflated.
5 to 10. I need a little bit more. I'll take 6 and keep it full.
Just check without me at the moment. I think so. First step is we are checking whether the balloon is working or not. There are many catheters where it doesn't work. That is why we are taking this step first.
Hold on, from down. Not touching the catheter as such.
We have to check whether it is
Should bulge.
not fixed. You just have to keep it there.
Right. My vision is working.
Your machine, yeah.
Her
Machine is
BP.
working.
It's only the cuff. You can see the bulb. Yeah.
Yes. Do you
You
see
can
the
see the
bulb is
bulb.
distending?
It's just in the right.
Yeah.
Yeah.
It's working. Remove it.
Yeah. I will withdraw the.
Just to check, huh?
You can keep it like this or we'll take it out.
No, we'll remove it. But have you finished?
I feel very funny. The correct moment. Edit your video.
Anyway, this is only for us now.
Please. I'll remove it now. Okay? I'll remove it and keep it to the side. Maybe we are taking it now. So now we need to prepare this also with the jelly. So I'll open the side.
We are not supposed to use this,
Yeah,
but we are using.
So imagine it is a sterile.
Yeah.
It should be sterile actually.
We cannot use this because we are taking all this care to do it in a sterile way.
Can I have that extra one so that I can just this
Cross
one?
it.
Yeah, cross. This one. So what I will do is I'll just open it. Till this side.
We can here to assess or something or no?
What is that?
We can to the patient assess.
We will come after that. First assessment is over.
First assessment.
Position and position is actually if they are the patient. You remember perineal care we draped. Same way we need to drape the patient.
Drape the patient.
Put Inco sheet. Keep the patient ready. You
Nice.
finish all your preparations. Then you go to the patient. That's easier.
Yeah, but one thing I forgot as Kulur told, I didn't assess the patient's perineal area. Actually, I think that we need to assess the perineal area.
That
No,
should be the
first is the
first
perineal
assessment.
care. Okay, we are not giving that perineal care. Ask the patient to go to the washroom and clean, or if they are bedridden, the usual perineal care what we give should be finished with wet pan, wash it with water or whatever it is. So that time you are doing assessment.
will be done.
Yes.
So that way we will assess the perineum. So we are sure that the patient is having a triple urine and we can insert, but again we went to the patient to assess whether the cooperation is.
Actually, we are allowed even to keep all these things
Mm.
here and
Yeah,
do it
beside.
also. It's not wrong.
Mm.
I have seen many
As long
people
as
do.
maintaining the
Yes.
sterility.
Same, same
yeah.
thing, keep it here. It's easy for you.
Yeah, we are going
Yeah.
to keep it. Now is, but before that, what is important is my one hand will be unsterile, the other hand will be sterile. So once I start the procedure.
Because she is going to touch the urinary meatus, separate and all
Yeah.
those things. So her left hand will become unsterile. And
Before
in
that,
the
yeah.
hospital setting, we have a fenestrated. It is fenestrated means there is a hole.
Hole,
in the
central
middle.
hole, like a central hole towel, no, we'll
Supposed
say.
to touch.
Ah, this
Yeah.
is
Yeah.
correct. No, she's just helping.
Yeah. Yeah.
Ideally, there is a hole in the middle. We put it there. Only the
Yeah.
hole we can
Yeah.
see. But they always give this cover. It's not right cover.
So now what's the easiest procedure?
Just
like
additional sterility we are maintaining. That's all.
what I'm going to do is dip
Clean.
it. Yeah, clean. We can dip and also what we can do is we can keep the, once we start doing the procedure, we can even use this to keep it there.
This is mainly for
For
urine.
the- for
When
the-
you want to put it,
yeah.
you will need it come. So throw it here only. We have 5. Majora, majora, minora, minora, middle.
Yeah.
Correct 5 they give.
So it's already soft. So
No need to squeeze. Even if it is dripping, no problem.
what I will do is actually it should come to the other side.
No problem.
Okay, what I can do is my hand is going to be unsterile, this hand, because I'm going to touch it firmly. And first I will start with the labia majora. So one straw.
Lengthy one, yeah.
I'm just from.
And throw it.
This is just passing to the next one.
So keep it there. No, you can even keep it there.
Yeah,
It's
keep it
easier.
here, it will
This is
be,
also sterile field only now.
yeah.
Yeah.
You can keep it here and
Yeah,
it will be easier because we are crossing the hands, no?
The next one, up. This is the labia majora. Down.
Yeah. Yes, like that.
Now I can spread the labia minora as such. Here it is not so easy, but I
Mm.
have to spread and
Yeah.
spread and clean it. Once only, up to down, once only. From this side also, clean it down. And then the final one, including the clitoris.
Clitoris.
Yeah, down. Throw that out. So now, what is the next step is, we are keeping this face open. We are getting ready to, we are getting ready to insert the catheter. So we will keep the receptacle here, and we are making sure the upper,
We have to now identify
Yeah.
2 holes will be there, no?
what is that?
First one is urethral,
Urethral.
always. I was telling
Next
all
is
the time,
vagina,
you'll get
because
time.
always the students, no?
Yeah.
Those first is
Covered over
very
the
good.
Okay.
Very
Leave the
good.
other end.
Now already we have lubricated and kept. I'm
Yes.
not
Inside.
inside the kidney actually.
Mm.
Like this, so that any urine dribbling, it will go down. What I will do is,
We will not still remove the cover. We are going to remove it as we are inserting. So we are, as much as possible, we are protecting it from infection. Okay.
so 2 to 3 inches away from the tip we are holding.
But the patient need to take a breath.
Yeah, take a deep breath, and while exhaling, we will insert. So just try.
This is very difficult over here because this dummy, we don't use it for one whole semester. Only we are the ones who will be using it.
Yeah, patient is nicely exhaling. My one hand is unsterile.
Vaseline. Greasy.
Yeah, very
Greasy.
greasy.
That's a
Yeah,
Vaseline.
it sticks to.
So,
Almost reaching. You can see it also
Mm.
through here.
Mm.
Just call them and show them. They can see the bladder.
The
and how
bladder,
it is
okay.
entering.
Yeah.
You see the blue one? It's not as easy as we think,
Yeah.
because when I had cesarean surgery, they put this for me. The first thing I wanted them to remove is this when I became conscious.
So now
So
it
painful.
is in position. but the urine is not dribbling because of the position.
Yeah, there
Position,
is
yeah.
little only there. It's okay, no problem. No need to come back. No?
Yeah. So what is the next step is, I will use the this hand. Again, I have not used my unsterile hand for this one. So again,
It's okay now, no
now
problem.
again.
This is
Yeah.
outside portion. Now nothing is going inside. No, she can be normal.
Yeah.
And there they can see. No?
Yeah, yeah, they
Yeah,
can
yeah,
see.
the-
Even the balloon they can see. When she is pushing also, we can see the balloon.
And the purpose also.
So that it will not come
Yeah.
outside, and when they are removing, they should remember to remove the water and then remove the catheter.
So,
Yes, it is inflated now. Yeah.
It's not,
Yes.
I can just slightly
Pull
push it
and
from
see.
this side. It's not coming. You can try. You can try.
Little more push. Inside.
Yeah. So once when we are deciding to remove this, we need to remember this.
How much ml?
How many
we have
ml we
inserted?
Yeah,
inside?
that's to
Inserted.
be. Yeah, it's coming out.
No, automatically when we keep the syringe when we want to remove, no, whatever is there inside will come.
So now the next step is
Connecting. Connecting. Not here. Connecting.
The bag.
Okay. We have taught them how to collect urine specimen from the catheter, right? So when urine is dripping now, she can collect the same container she can use to
Yeah.
collect urine now. Okay?
Yeah, will it the same syringe?
No, no,
Or
the container directly here.
Oh,
She can use it to collect
for
or
this
connect it
test.
to this.
so and
Actually, the urine is not
Ah.
coming.
oh,
Yeah, yeah.
no, let it go.
Leave it.
Yeah, it's coming.
I want to see it. Yeah.
With the
Maybe
difficult.
we'll fill it more with the
More,
water. We know
then
how to
only
fill
to
it,
do.
so that it will come.
And
Actually,
maybe
they
again.
put yellow color and all and make it as
Ah.
real urine.
Now we just
Today I
It's
think we
coming?
forgot.
a little.
I don't think.
Ah,
Because it's higher.
At least, yeah.
Mm.
Yeah, yeah, yeah.
Okay, so we will be collecting urine
Yes.
and
And
then
then-
connecting it to the bag. Now don't worry much about
Yeah.
sterile testing because we finished.
Mm.
Inserted
Yeah.
inside. So
Yeah.
now she can, it's okay, she can touch.
It's still inside. We are not. And this is very explain the purpose of it. Yeah.
Yes.
So now we are going
It
to
will be
leaking there.
Yeah, there is already some.
Mm.
Yeah, already it is there. So I'm going to use this one here. No, correct, no?
Mm. Just on the
This
side.
one. Here. Don't make it so tight, so that patient. And this will be hanged down, down in the sense below the waist. And there is a special area where we can actually hold it.
By the time you can take this.
Yeah. There is a hanger here.
Yes,
that we have.
Many times mistaken how they put it in the side rail, so when they push
No,
or
in the
down.
hospital, there is a hook
There is a
like thing.
like that
This
it will
cord
be.
does not.
It will be like that.
See, we have, these are the
Yes.
areas for that.
See, the tip is here.
It's a guard and two
Yeah.
hooks are there.
Mhm. It is here, yeah.
Both sides.
See, both the sides it is there. So you can hang it.
And also we need to so this to be labeled and sent for the culture and sensitivity or for the any other urine. Then we need to remove the gloves.
Some instructions to the patients.
Yeah.
When they are getting up or when they are going to another place, they always want to carry it. It should never be held above the waist, which is a very, very important instruction which we need to tell them, because reflex
Yeah.
from the bag, it can go back
Go back
inside
to the.
and it can cause problem. And if we find any cloudy appearance or precipitation is very common when they are on this for a longer duration. If they find like that, it should be changed. Okay, now they are on this maybe today 2 days over. They want us to collect urine specimen. How do we collect it? We have to clamp it for some time, then disconnect at the edge. We should not take for urine collection from the bag. It is wrong. Even for checking for sugar, we should not collect it from the bag. Okay, so we need to take a clamp it for some time, directly from
Like this.
The
tube only we should take.
like fresh.
Yeah, they take one.
Clamp it.
Yeah, they take one sterile syringe and then remove it. Or if it is coming, once you release it, if it's coming automatically, also you can hold it.
And also this also for if you want to.
You can remove. They can puncture and remove
Puncture
urine
and-
from
yes.
this. If they want, like for example, culture and sensitivity,
Yes.
so
Mhm.
they have to be careful. I think they clean it with alcohol,
Alcohol,
so
and then
they-
they take.
Earlier, I know when we had that very old olden days.
Our student days are olden days.
Yes. And intake of the charge we need to maintain.
Yeah.
As well as we need to record how much amount of air or normal saline we have inserted or the water for injection we have inserted into that bulb. So that also we have monitored and recorded. And the urine culture or sensitivity, culture and sensitivity.
We have sent it all those things. Yeah.
And whatever urine collected down, we will monitor as per the instruction. Hourly or whichever. Maybe a little
Whichever.
If you
Yeah.
want, you show your students how to remove also when you are finishing. Okay, so you teach them wear a glove, put a syringe, remove the water,
Water.
which we have put it in the bulb first,
Yeah.
and then just remove and discard the catheter.
A sterile
Yeah.
technique or
Just
clean technique?
Just clean thing. Just remove clean thing. And then after which they may have to give perineal care or they have to observe this thing. Actually, when you are removing, you should instruct the patient about some exercises also, because dribbling may be common if they are on catheter for a longer duration. So we will have to teach them about
Kegel
the
exercise.
Kegel exercises, pelvic exercises, so that and drinking more water